So firstly, I had a shoulder injury back in, let's say, 2010, 2012. And I popped it out, but I naturally just like instinctively jerked it back in, and I thought it was fine. But as years later, like I find out that as I'm working out, it's not fine. I'm actually struggling to progress in my workouts. Same thing happened with the trauma to my spine, my hip, and lower spine, and my hip and my knee. I just got into a very awkward position like that, and the person really pushed it very hard, and so I was like that, and I was in immediate pain. I immediately got up and I jerked it, and like same thing with my shoulder. I thought it was fine. It wasn't. Now I have like mobility problems with my right side. I can't really turn properly without feeling tension in my spine.
Yeah, there you are. Got a nice heat reading right at that level. And we got something here too. Got a chronic nerve. And we have another one out here. Another one at this level. So when I hear a case where he has a lot of trouble doing push-ups, doing pull-ups, so on and so forth, and there's a lot of muscle weakness, I want to evaluate what's going on with the muscular structure connected to the scapula itself, the shoulder blade. Because clearly there's some kind of neurological dysfunction going on in this region over here, just not having enough nerve function to these rhomboids and the lats and all the other muscular structures over here to keep the scapula in place. So therefore, any type of force applied to it, it just collapses. So the area of the region of spine we're going to focus is right here in the mid-dorsals, and clearly what I've popped over here is chronic, but yes, there is edema right on this level. Okay. And we're going to test it. Tender right there?
Yeah.
Yep. So we also confirm patient's tender, and right at this level, remark. Next component, the patient's also talking about, okay, right hip clicking. He has a lot of problems doing sit-ups and crunches, especially when he does hip flexion so much. There's right here, he has pain, right in the inguinal region over here. So I'm going to focus what's going on in the pelvic area. So I'm going to motion palpate this one over here. See, his left side is moving. The right side, this ilium over here, is not moving too well at all. Now there is some pulling of edema over here, so we're also going to palpate. How's that over there? Pain?
Yeah, I feel something like before, like a semi-funny bone. Yeah, it feels.
So
it's bearable. Yeah.
So when we test the sacroiliac joint over here, it elicits pain and discomfort over here. The left side, how's that?
This one feels fine.
Right?
Yeah,
So
it feels
not a problem on that side.
Yeah.
We're gonna move up. See how this one. How's that, fella?
Very dull. Like
Very dull.
Yeah. Like,
Let's move on to the next. How's that one?
This is okay. Like,
Not too bad.
Yeah.
Got it. So then we're gonna move up. We're gonna test all the other structures. See what's going on. Now, right now, everything is rigid and very stiff.
Yeah.
And right here, okay, that's where we find the heat reading right at this level over here, and there is a fixation over here. All right, so we're gonna mark this level. Come on, moving upwards again. Everything is fixated and rigid until we go to this one over here, which we already confirmed earlier.
Oh yay.
Okay, keep on going. And everything else is okay. So next we're gonna do is the Gillet assessment. So what I want you to do is go ahead, champ, march in place. A little higher, good. So we see over here, it should be equal. The thumb should be going downwards. The left side is moving fine. The right side, it's not budging too well. All right. Now we're gonna go PIIS. So it goes downwards fine. This one is going completely diagonal. Right? So go ahead, stop. March again. So it's definitely fixated here as well. Okay. Go ahead, march again. Okay. So we confirmed it. So it's able to, the sacrum pivots on this side, does not pivot on the left side, and is also fixated on the right sacroiliac joint, the right ilium over here. It's not moving downwards and is having an EX excursion. So when it goes diagonal that way, that tells us there's an EX component on this ilium over here. I identified several things that can help explain what you experience right now, right? So the major thing is this right ilium, right? Your hip, it went this way, right?
Yeah.
So since we became torqued out this way,
Yeah.
that's what you're feeling, all that discomfort and pain right in that joint over here.
Yeah.
Right?
Yeah, definitely.
It also can pinch off the joint over here as well.
Yeah,
Right?
yeah. I
So
feel
that's
a
why
lot.
you feel that trouble going this way.
I do.
Another component I see over here that the disc got damaged is that fourth lumbar. The nerves also innervate to the pelvis as well. So when we correct this does need to be corrected in the future visit.
Yeah.
I tested this today. Right now, you don't see any pain.
Yeah.
So I would not be surprised that this will become more discomforting in the future.
Yeah,
Right?
yeah.
So this is something we need to correct in the future visit. Now in regards to what's going on with that right shoulder, right? We're gonna restore the nerve function, and it's here, the 6 dorsal. Because if we see over here, your
Yeah.
spine is deviating this way, so over this way, and over here again.
Yeah, I see. Yeah.
So so between all that curves, that one started to deviate again, right there. So this one over here supplies nerve function to your shoulder blade. That's the one we need to correct.
All right.
Because of the way this fifth lumbar is rotated and the rest of the lumbars are rotated, you can't do just a push and a pull. Neither is going to work on this patient. It's going to aggravate the fifth lumbar and the fourth lumbar, because that fourth lumbar we need to correct in the future. So this one, we actually need to correct this prone. All right, champ. Right ESCX.
Oh no, I definitely feel a lot more balance. You know, like before I was shaking when I was marching, but that's immediate sharp pain. No, I definitely don't feel the shaking anymore. So yeah, wow. Okay. Yeah, I feel pretty good right now.
All right.
Yeah.
Ready for round 2?
Oh yeah, for sure.
All right. So tell you what. Why don't you show the viewers right now? Okay.
Yeah.
Go ahead. Do a couple push-ups. See what your right shoulder can do.
Push-ups?
Yeah.
Oh my.
Okay. I'm going to show you the viewers over here. See how much this right scapula over here is engaging? Okay. Go ahead. Try to do a push-up. The muscles over here. He's trembling. Everything here is trying to work harder than it should. The scapula is not engaging right. Right there.
No, well, right now it feels good when I fan out like this. It feels a lot better from before. So that I can definitely say.
All right, so drop it. Give me 10. Oh, what else are you noticing?
Oh wait. No, I definitely feel better.
No, go ahead. Give me a full set here. So we were start seeing the muscles start to engage a lot more easier and better on that right scap over there.
I don't feel the pressure on my right elbow as much. So no, I definitely feel better. Yeah. I need a lot more time to really adjust to this. But yeah, I think I feel pretty. You know, this I know for certain. My balance is definitely. I'm not shaking. Before I was shaking, so I don't feel.
Right.
I don't.
When you were doing that Gillet test, you were shaking like
Yeah,
crazy.
I was shaking a lot. So I definitely know this is better.
Okay, in the previous visit, before we adjusted your spine,
Yeah.
you also you were hesitating, and also you were having trouble keeping balance with your hips.
Oh yeah,
So
yeah.
how was that?
Definitely. My that also plays with the comfortability. Like the balance. Since I have more balance, I spend less energy thinking about how to walk.
Good.
And so I can like that relieves me. That in itself makes me feel better.
There you go. Good.
This I was not able to do before, you know. So I'm very stable right now. So my hips are,
Nice.
you know, like I can feel it. Oh yeah, the push-up now was a little bit easier. Yeah.
Good.
Yeah. So it felt easier. So. You know, I still need to try it out, like, you know, like just like on Friday. I need to see if my knees are sore tonight again.
It's gonna take some more time because we gotta rebuild this.
Yeah.
Right. Just to get more nerve function to all the muscles over here.
Yeah.
Get it working a lot more better.
Yeah.
All right, champ. We're all set.
Thank you. Yeah.